to everyone. Thank you for being here for this gathering and webinar on reproductive rights, access and advocacy here at home in Connecticut. I wanted to, for those that aren't very familiar, to introduce everyone to the Community Fund for Women and Girls as part of the Community Foundation for Greater New Haven. It is Greater New Haven's only endowment dedicated to promoting the social and economic advancement of women and girls. The focus of the fund is to improve the quality of life for women and girls in our region through education, research, advocacy, and most importantly, by encouraging women's philanthropy. For me, it's been so important to see such a great group of women leaders coming together to really focus on women and girls issues across our region. And I've learned it enforces a gender-based and feminist lens of giving, a philanthropy, of activism, and it really aims for systemic changes, not for just plugging holes, but really changing the way in how all giving and work towards improving the lives of women and girls and beyond in our community is. So, so far we've awarded nearly $200,000 to Greater New Haven nonprofits working to support economic security for women. We've just started a Girls for Color mentoring network. And anyone that is more interested in this fund, we encourage you to reach out and join us. There's many ways to be involved, so please do join us. And one of the things that we do are hold events like these convenings and gatherings in which we could discuss global, national, and local issues that are most pertinent to our community and the women and girls in our community. So before I continue babbling on, I would love to introduce our amazing panelists today. I'm not going to do full bios of everyone because many the work and reputation of these amazing people can speak for themselves. We have Karen DuBois-Walton, board member of Planned Parenthood Votes, and so much more, and an amazing leader in our state and in New Haven. We have Sally Grossman, who is an advocate, an amazing storyteller for Planned Parenthood, and Amanda Skinner, who is the current president and CEO of Planned Parenthood of Southern New England. So I would like to welcome you all to the panel. Hi, thank you so much for joining us. I just would like to start about knowing what's going on. We're all concerned. I think all who are here are concerned. So I think frightened about the state of reproductive care and health access for women across our country. And although Connecticut is known as a sanctuary state and a blue state, what is the status of reproductive rights and abortion here at home in Connecticut? What do you see is going on the ground? And if you could just elucidate what your experience has been, the laws that theoretically made it more accessible to women in Connecticut, has it done so? Has it elucidated other problems that are deep-seated compared to some of our sister states? So I guess, Karen, I would open it to you and sort of you have uplifted so many voices in the community, in our community, and what are you experiencing and seeing?
Yes, thank you. First of all, thank you so much for your focus on this most important topic. I'm drawn to the work of Planned Parenthood and was proud to serve on the C3 board. And when I finished my term there, transitioned to the PAC board, which is great because I get to say the more political things and to dig in on the activist side of the fight for reproductive access. This is a very personal connection. I got involved with Planned Parenthood as a patient when I was a young college student here at the university, and went to Planned Parenthood because there was a lot of stigma and shame associated with abortion access and with reproductive health. And rather than go to Yale University's health clinic, went to Planned Parenthood. And I mention that because when I think about the state of today, there continues to be, despite all this time and despite all the work, and now maybe heightened because of the time and the Dobbs decision and what's happening, there continues to be stigma and shame associated on women's right to access health, make healthcare decisions, and to control their own healthcare and bodily decisions, right? And so I think that's very much alive right now. I think the Dobbs decision nationally unleashed in the political discourse in Connecticut stuff that we had been not hearing quite as vocally as we're hearing again. And I listen to political ads right now, and we see people that are running on an anti-choice, anti-abortion platform in a way that even a few years ago was a little more muted. So I think it is a real issue in Connecticut, and probably Amanda's best positioned to speak to sort of the on the ground sort of fight and issues that are in front of us. But I really want to raise up that this is real in Connecticut. It's really at stake. You're hearing all the time, democracy is on the line, democracy is on the line, healthcare access is on the line, abortion rights is on the line here at home in Connecticut.
Thank you so much, Karen. Hi, everybody. I'm Amanda Skinner. I'm the CEO at Planned Parenthood. Like Karen, I have a personal history with Planned Parenthood, not just a professional history. I was a Planned Parenthood patient. I had an abortion at Planned Parenthood, and this work is deeply meaningful to me. I also want to quickly note that Sally is also on our Planned Parenthood Votes Connecticut board, in addition to being a powerful community advocate and voice. So I just want to shout out Sally for that as well. When we look at what's happening on the ground, I think there's a few things. First of all, one of the things that was really interesting was that the Dobbs decision was a surprise to so many people. There was a huge believability gap, and I think we still are facing that believability gap as we, think about reproductive rights being on the ballot and what does that really mean? Because everybody has to buy gas and milk. Not everybody needs an abortion tomorrow. But when they do need it, they're really going to wish it was there. But it's not as sort of like right and super present for everybody. And I think we need to really lean into the reality that abortion rights and reproductive rights are a proxy for our democracy. As long as we allow for a democracy that says that half of the population doesn't have the right to control their own bodies, lives, and futures, then we don't have a real democracy. And so I think we need to note, and I know we're going to talk about this today, the economic impacts and issues associated with abortion access and how abortion access really is critical to people being able to live full and free lives. So what are we experiencing now? We are fortunate. We're in Connecticut. Connecticut was a leading state. We actually passed the first state law in the country 32 years ago, codifying the tenets of Roe versus Wade into state law. But Roe was the basement. It is not the ceiling. What Roe did was say that, abortion under certain circumstances was a right. It does not position abortion as something that is truly healthcare and should be a decision between an individual and their healthcare provider, which is what we believe it should be. And Roe did not create meaningful access to abortion for all people who need it, because people continue to face right here in Connecticut significant economic, structural, transportational, childcare barriers to being able to access the care that they need. And so while we have the legal right to abortion protected, I just want to, again, sort of lift up that access to abortion, particularly for people who struggle the most to access basic healthcare, remains a challenge for a lot of people in Connecticut. We are also really fortunate that we did make some progress this year. We passed the Reproductive Freedom Defense Act in Connecticut. And the Reproductive Freedom Defense Act did a couple of important things. It allowed us to expand access to care for abortion care in Connecticut, because one of the constraints people experience was a limitation on providers who provide abortion care. And we now have expanded providers to include advanced practice clinicians who can provide first trimester aspiration abortion. We have graduated at Planned Parenthood of Southern New England, our first class of clinicians who are able to provide that care. We also updated the language in our law to be more gender inclusive, which is incredibly important to really live most deeply into our values. And then we also passed elements, there are elements of that law that provide protections that are intended to protect providers from some of these, really onerous laws and bans that are being passed in other states. And as of right now, 18 states have either banned or severely constrained access to abortion. That leaves millions of people across the country without access to care. But what I do want to say about the Reproductive Freedom Defense Act is that that law is untested. We don't know exactly what it protects to the extent of protection it's really going to provide when the rubber hits the road, because it hasn't been tested yet. So we should be really, really proud, but we shouldn't take our foot off the gas. We need to remember that this issue is critical. It's critical to our freedom, and it's critical to our economy, and it needs to be at the center of people's minds, especially right now, and especially a week from now.
Thank you, Amanda. You spoke some of the economic impacts and the impacts that I think just knowing the Tubbs decision and hearing the news every day about what's happening reproductive rights really just is emotionally wrenching and personally affecting not just my life, but that of my daughters and my friends, and knowing what's in store down the line for the future, and especially the economic impacts and financial crises that this does create in our communities. And so I know, Sally, you have your own personal experience and stories of how dealing with access to healthcare and reproductive rights and abortion rights locally has been for you personally. Can you elaborate more on your story, please? And thank you so much for opening it up. I know I'm so glad all of you did mention your own personal experience. I have a personal experience with Planned Parenthood too, and had an abortion when I was 16, and I'm so grateful. And I think destigmatizing it is one small step, but your testimony is just very inspiring. So thank you for stepping up and showing up.
And I love the fact that everyone on here shared their own story right away, because that's really what's needed. I've been volunteering with Planned Parenthood for about 5 or 6 years, and what I love is when I'm in a space like this, I'm one of the only people that's a blue collar worker. I work in construction. I paint houses, and I come across people from all walks of life, people who don't necessarily think the way that I do. And I've noticed to your first question about how people are feeling now, after jobs, no one ever talks about abortion on a job site. Where you're not I'm not with a bunch of men and they're talking about women's reproductive rights, but it comes up now. It is something that people are actually paying attention to. But as far as myself, I'll be very brief. So I'm on Medicaid. I'm on Medicaid, and I went on Medicaid when I became pregnant with my son. He is now 9 years old, and I became pregnant with him, and this was prior to the ACA. And I realized that my existing health coverage did not cover maternity, even though I thought it did. So I called and asked for it to be added, and I was told that it can't be because of my pre-existing condition, which was my pregnancy. And I actually had planned on terminating the pregnancy because I could not afford to follow through with it. But luckily, I was able to get Medicaid, and it covered the cost, which was substantial, because I had some health issues and was hospitalized during my pregnancy. I was on bed rest for the last 3 months, but I did have a healthy child. But then a year later, I got pregnant with an IUD in place. Even though IUDs are supposed to be, the most effective form of birth control, it was not. And I had to terminate the pregnancy. The fetus had grown around the IUD. And I was in Connecticut. Medicaid covers abortions, which is not, it doesn't happen in every state. That's not that common. And I was lucky because I went to the doctor. They did ultrasounds and everything like that, and I was able to make a decision that was best for my family when I needed it, and get the care I needed, and it was paid for. And so I'm trying to I'm getting a little upset right now. Sorry about that. Yeah, it's sorry. Every once in a while, this story makes me really sad. And it's I have a daughter who's 5 years old, and I was thinking how I was able to get the care I needed when I needed it, and that she won't have she does not won't have that right. And sometimes it hits me because I can't imagine a world where she would have to wait until her health her life was in danger in order to get that care, and that could have been what would have happened to me. But being able to make reproductive health care decisions for myself is what allowed me to, have my creative business. It's allowed me to work. It has, allowed me to raise a family. Sorry, I'm gonna need a minute. Let's go on for.
Absolutely.
Because Sally, and what, Sally, I think your emotion is really driving home like the real human impact of the circumstances we find ourselves in.
Absolutely.
And I'm a sympathetic crier, so I'm just
I know I'm trying really hard, and I was prepared, and then
so I'm with you.
You know what, C4 it's the reason why we have to have policymakers in place who actually connect to these stories and understand these stories and can put themselves in Sally's shoes, in my shoes, in Amanda's shoes, in Christine's shoes. And, unfortunately, we have a system that has been dominated by folks who will never birth a baby, never be impregnated, making decisions about a women's bodily autonomy. And I believe that part of our mission at the C4 is the work to elect the right, progressive people who are not going to be afraid to say abortion is healthcare, who are not going to be afraid to fight for women having autonomy and over their bodies. And it is why we are doing this work, even so many years past Roe, when folks thought it was settled law.
And Karen, just to bring in that, back to part of Christine, what you would ask me is like, what's the state of play on the ground? I mean, the state of play on the ground for us is that we're seeing patients travel from as many as 1,500 miles away to get the care they deserve, right? And that is not something that's accessible to all people. To be clear, what we know is happening with these abortion bans is they're causing the most harm to people who struggle financially, who may live in rural communities, Black and Brown communities, immigrant communities, LGBTQ plus communities, people who are already marginalized by the healthcare system, people who already are suffering financially. And now we're asking them to travel 2,000 miles to get access to basic health care. We've seen, significant increases in the number of patients we see from out of state. Currently, about 6% of the abortion patients we see are patients coming from other states to get care here. Imagine a world where you had to travel 2,000 miles to go to your cardiologist, right? That's a real reality that people are living right now, that their ability to access healthcare and their ability to plan for their own future is determined by their zip code.
Thank you, Amanda and Karen. And Sally, I want to thank you for being so brave and telling your story. Once I heard from a writer that our future is dependent, it's a battle of stories, and whose stories get told. And for so long, especially with abortion and anything dealing with the woman's body, has not been, we've not been allowed to speak, and people have not wanted to hear. But it's so important. What you are doing, I think, is the most important work, is telling your story, and telling a story from so many different aspects. I mean, we could go on by policy, but policy recommendations aren't necessarily going to move hearts and move minds. So
I did want to add, I'm sorry, I collected myself. And I know everybody, anyone who knows any girl, whether it's daughter, niece, just friend, there's moments when it just becomes too much. But I do know it was hard in the beginning to share my abortion story, because I had an abortion that was, considered medically necessary. It was not a viable fetus. And I was able to get the care, and I shared that story because there was no shame in that story. Society told me that was okay, that was a necessary abortion, that was an okay abortion. But then I realized that I never shared the story about when I was 24 and I had an abortion because I got pregnant, by a boyfriend that I'd only known a couple of months, and I didn't want to have a baby. And I decided that was a really important story to tell, because I'm not ashamed of it. It was the right decision, and it is what allowed me to have the family I have today. But I remember walking past, protesters. This was in Georgia, walking past protesters and just, yelling all sorts of things. And I didn't feel shame for myself. I knew that other people thought it was shameful, and I didn't tell anybody about it. But once I started talking about it, I spoke at a rally. It was in October of last year, I think. And I had my 4-year-old daughter with me at the time, standing up there, and I swore. But I talk openly about abortion. And then later that day, and for the next week, I had friends who had never known this. They started telling me about their abortion stories, and they started opening up, and we just talked like you would talk, like we talk about giving birth, right? You get together with your mom friends and you talk about giving. We just talked about it. And to me, I've never seen that. I've never seen the openness. And now there are so many women like me who are saying, like, this is enough. I think it woke a lot of people up, and they're saying, no, this is healthcare. This is healthcare that I needed, that I was able to get. And this is what the generation that comes after us deserves. And so if anything, seeing more people realizing that we need to destigmatize abortion is something that I'm seeing a lot of.
I mean, part of what comes to mind for me, Christine, when you talk about, what's the state here, is right. A right isn't a right if you can't access it. And the work that we've been doing at Planned Parenthood votes and at PPS&E has been intersectional work that's really addressing the fact that healthcare access requires us taking on so many of the systems that are creating barriers to people's ability to exercise their right. And so it forces us to speak out on issues of healthcare access, but also on safe housing, right? Also on how we're addressing transportation needs, and all of the things that, that Amanda talked about, really digging in around, is part of how are we actually making sure that women have control over the choices that they're making for their body. And so that's part of the fight here in Connecticut too, is to make sure that we are focused on those who are most marginalized by economic status, by race, and ethnicity, and by disability, right? That we're really focusing on and ensuring that access is really there to be able to access all their healthcare needs, including the abortion needs.
Thank you.
And Karen, I'm just Christine, we're just going to take over here.
No, please.
The thing I want to jump in with is actually coming back to the and lifting up. You started with it. Sally talked about it. Christine, you alluded to about the power of storytelling. I think we are in the circumstances we are in right now, in part because we have allowed abortion to be shamed and stigmatized. And when you shame and stigmatize something, you give the impression is given to opponents that they can carve away at access to that thing. That it is up for negotiation or debate. And I think our ability to control our bodies, to make decisions for our families and futures, and for ourselves, should not be up for debate or negotiation, right? That we should be talking about abortion, making very clear that this is healthcare, and then talking about it in that context, because that is what it is. It is not about messaging, it's about reality. And listen, 1 in 4 women in the United States have had an abortion. And to borrow the words of Renee Bracey Sherman, everybody loves somebody who has had an abortion. Everybody does. So we need to talk about this, because this is not something that should live in the shadows, or not something where we should allow our futures to be up for negotiation in the hands of politicians, as we have heard from some people running for office these days.
Thank you, Amanda. Your words affect me so much. I wanted to know, post-pandemic, we know that women have been disproportionately affected by the pandemic, especially economically. And how have those effects been seen at Planned Parenthood? And another part of it is, I think, just also demystifying what it is, what it does cost to get an abortion here in Connecticut. What is it like? Is there how can it be done through insurance? I think demystifying a lot of aspects through it, even the nuts and bolts finances of it would help a lot of communities, and we have a lot of community leaders who are here on this call that also can spread that word that it is not this secret shroud, and that we can help. So.
Well, just, speaking from the provider perspective, I would say a few things. So first of all, Sally mentioned this, that one of the more important things we've done in Connecticut is ensure that Medicaid will cover access to abortion, because it is an injustice to put the burden of paying for the cost of an abortion on the people who are on Medicaid already, which already is an indicator that there are some financial struggles for those people, right? So it is an issue of health justice and health equity that Medicaid covers abortion services for people. Most commercial insurances cover abortion in Connecticut, and at Planned Parenthood of Southern New England, we are absolutely committed that we will not turn a patient away based on their ability to pay. That is part of our mission, and we will meet people wherever they are. And there are a host of costs associated with abortion. The abortion itself is a cost, but there is the cost of time away from work. And if you don't have paid time off from work, then that is a significant financial burden for people. There's a cost of transportation. There's the cost of childcare that somebody might need to get when they need somebody to watch their kids. And most people who have abortions have children already. And then I do want to quickly lift up one of the things that we know at Planned Parenthood is there's actually a lot of research on this. And we know that there are actually both personal and societal costs when people are denied abortions. So there was a study done called the Turnaway Study, and women who are denied a wanted abortion, who have to carry an unwanted pregnancy, have a 4 times greater odd of living below the federal poverty level. We know that women who are denied a wanted abortion, even years later, are more likely to not have enough money to cover basic living expenses. And we know that this harms their children, because the financial insecurity income impacts their children's outcomes. Because most people already do have children, the children whose mothers have already been turned away from having an abortion that they wanted show worse childhood development outcomes, right? And then there are societal impacts. Even prior to the Dobbs decision, state economies were losing $105 billion a year economically due to abortion bans. And there's actually been a great study that shows that if we eliminated any abortion bans and we had real, genuine access to abortion for all people who need it, meaningful access, as Karen said, not just the right, but meaningful access to care, our GDP in the United States would grow by 0.5%. Doesn't sound like much. That's $1.3 trillion. That is a lot of economic impact.
Amazing. Thank you. I mean, we speak of economic impact, and we are 6 days away from a major election, a midterm election, and the pollsters and pundits are not forecasting good news. But what the conversation all about is, this is all about inflation. This is all about prices. This is all about gas prices, et cetera. And you have talked about the deep economics of having health access for women, reproductive care, and access to abortion. what is at stake for reproductive rights in this midterm election and beyond? What can the political process do for us? And really, I'm just trying to hold on to, like, what can be done? What can we do? What if you have a call to action, what can we all do, whether it is in 6 days at the polls within that day? What calls can we make? What can we do and give? Feel so desperate and and afraid. And so please do let us know, because we know that this is your life's work, and you already are doing things through Planned Parenthood.
So I'll jump in on that, and then certainly I want to hear from Sally and as well. But one thing I would say is take a look at the candidates in this state that PP Votes Connecticut has endorsed. Those are folks who have said that they will and have a track record of fighting for abortion rights, fighting for healthcare access, and they need support. They need help. They need to get over the finish line in this next week. And those are folks running for statewide election across our state. I know this is mostly New Haveners, but I spent some time last night making phone calls for Congresswoman Johanna Hayes, who's in a battle for her seat just a district over, against somebody who has an anti-abortion record, who was seeking to represent Connecticut in Congress. And we need to push back on that. And ensure that we're supporting a candidate like Johanna, who has been pro-choice and has been fighting for this. When we look at the record of folks who are running on the anti-choice line, they're not just anti-abortion, right? But they're also not investing in any of the things that are about good family policy, childcare, education, housing, right? All of these things are at stake if we're not fighting. So I would say, one, look at who we're supporting and get behind them and offer them some help knocking on doors this last week, contribute to their campaigns on the political side, and give to PP Votes Connecticut, give to Planned Parenthood, because the access to healthcare depends on us having a set of clinics across the state that are continuing to do the work that Planned Parenthood is doing. So get involved there as well. And don't be afraid to ask folks when they're asking for your vote, their position. And let it be known that you are supporting candidates who are going to fight like hell for women's reproductive rights.
I did want to add something, and I'm still kind of stuck on Amanda's last point about the economic impact, because we aren't just talking about abortion, right? Ability to get to your appointment. I was a volunteer clinic escort, and I saw people taking Ubers from 45 minutes away because no one would bring them, and then they had to pay for that, and then they had to pay for the ride back. There's people that missed work. There's people that had to bring their children to the appointment, but that's just one aspect of it. We also how I got involved with Planned Parenthood was actually because of paid family leave. And that was the first thing I ever testified for. And I was 9 months pregnant at the time. And I shared the story about my first pregnancy, how I was put on bed rest for the last trimester for 3 months, how, because I work for myself, I don't have access to paid family leave, which meant I had no money for 3 months. And then I had to go back to work 3 weeks after giving birth via C-section. And so that was a story that I told, and I thought it was a silly story. I thought it didn't matter. I remember sending it and thinking it was just, it's just sad for me. And, I deserved it because, I didn't have a job that offered paid family leave, and that was my own fault. And, if I just done better in school, then, I wouldn't have this problem. And I learned that, frankly, that's bullshit. Like, everyone deserves time off to heal, to spend time with their newborn. Everyone deserves that. And so Planned Parenthood supported that. And that's how I got involved, because I was like, oh, it's more than just abortion or, uteruses or whatever. They also supported an increase in the minimum wage in Connecticut, which is, up to $15 an hour. But there's also the childcare costs. And I can't even tell you, I qualified for Care for Kids, which is a subsidy. I was still paying when both my kids were in childcare like $1,800 a month in childcare costs, and that's with assistance. So, you know, all of these, so the paid family leave, the minimum wage, these bills were passed because we elected people who were willing to fight for this. It wasn't easy. Like on the floor, they got hammered with questions, you know, and they were attacked. It wasn't easy, but we were able to do that because we elected the right people. And the only reason that Connecticut has the laws they do protecting reproductive freedom, protecting abortion, is because we elect people who can do that. And we are very close to not having that. If we have a different governor, or if we lose the Senate, these rights can be taken away in a heartbeat. And I think that's something that people do not understand, because they think we are just safe here. It's Connecticut, we're blue. We haven't always been blue. And so we always will have to fight. We will always need to fight to protect what we deserve, which is just freedom over our own bodies. But there is never a time when you can just take a break and go, oh, okay, that's it. Abortion is legal in Connecticut, I'm good. Because first of all, other states aren't. So you should be fighting for everybody, but we're not safe here in Connecticut. And so if anything, I want people here to know, you need to fight. You need to find where candidates, people who are running in your district, what they support, what their views are, and then support them, volunteer, give money, and vote, just go and vote. Because that is, if we don't have the right people in, we don't have any of these rights anymore.
Thank you, Sally. I remember after the jobs decision, I thought some of the people that hang out in front of your office every day would go away, but instead they've been even more emboldened. And it made me realize that, Sally, you're right, we can't stop fighting. And as you three are warriors on the front lines, and want to give just such gratitude, but also want to check in with you on how you're doing and hopefully you're getting the supports you need. And if any of us here can support you, because it is endless, heroic, but necessary, vital work for all of us. So,
I mean, I'll just say it's the privilege of my life to work at Planned Parenthood. So I'm fine. I'm fired up. And I feel very privileged to do the work that we do every day, taking care of the patients who are counting on us, trying to ensure access to care. We're an educator. We provide sexual and reproductive health education. We're an advocate, as we have talked about today. And you know, one of the things that I love about Planned Parenthood is that we really understand that those three things are necessary and critical to potentiating each other. What good is the provision of healthcare if people don't have meaningful access to it or the right to it? What good is the right to it if it's not existent in your community? And what good is any of it if you don't have enough information and education about how to control your body or make good choices for yourself? And so, you know, all of the parts of our mission are critical and necessary, and so like just deeply, deeply important to me. Our staff are frontline healthcare workers, and many of them have to walk through protesters on a regular basis to go to work, just to go do their jobs each day, and to do work that is really meaningful to them. And that is exhausting. It's exhausting being a frontline healthcare worker after 2.5 years of a pandemic. It's exhausting having to walk through protesters. It is, you know, our work is emotionally heavy often. And I think, you know, that's a cost we didn't really talk about, is the emotional toll of all of this, and the emotional toll on our patients. You know, Sally talked about what it's like to go access care and have to go through protesters. And, you know, I remember for myself, when I went to have my abortion, I was an adult woman married to the same person I'm still married to today. And I went to Planned Parenthood, and you know, was thinking how lucky I was that I was in a car and I got to drive through the entrance where the protesters were. I didn't have to take a bus and then walk through the entrance where the protesters were. And what a point of privilege it was to just like drive on past them. But there is an emotional cost. There's an emotional cost to everybody who works in healthcare, and to everybody who works in this movement. And yet, I hope for those of us who are, you know, dedicated volunteers like Karen and like Sally, and dedicated staff like the team at Planned Parenthood, that the deep understanding of the critical importance of our mission, and to lift up what also has been said, that we cannot take our eyes off the ball for 1 second. That we need to persist. We need to be tenacious. Knowing that and knowing the difference that people are making in other people's lives helps mitigate some of that exhaustion. But it's not enough. Cookies help too.
It is so inspiring.
And resources help.
It's just so inspiring to be around Amanda and her team and the volunteers and everybody who does this work, because while parts of the country may have been taken aback by the Dobbs decision, there are others who've been working in this fight, folks like Amanda and Sally, who have seen this coming, because it's been a long game that was orchestrated by those on the other side for decades, right? And the strategy of building to a Supreme Court that would make this decision, it was built, decades back, of building up the bench and getting folks into power in order to get there. And there have been others on the other side seeing that and raising the alarm bell about this forever. Amanda being one of those leading voices around that, and folks here in Connecticut who push to have the right things in place. So I say, listen to those voices. Listen to those voices, because they are out there and they are warning us, and they're warning us in this moment right now about how important this November 8th election is. I'm not going to say what everybody says about it being the most important election of our life, right? But listen to the people who are sounding the alarm, because this is real. This is real in terms of what is at stake right now. And why it's so important. So yeah, the other thing, thank you, Sally, for saying vote, bring everybody to vote, get everybody in your circle to ensure that folks are voting, and help get others out, because it is that critical right now.
And remember to vote on the referendum for early voting, which is on the right side of the ballot as well, because this will help increase voter access in our state, which is only next to, I think, Alabama and Mississippi on not allowing early voting in the United States. My last question was actually, what makes you hopeful? But I think you've made me hopeful in your last remarks. But I just wanted to first offer up to any of the attendees to please ask any questions in the Q&A for our Q&A session in a few minutes. But yeah, what are some lights that down the tunnel that you are looking towards, that you are hopeful for? I know you spoke about a lot of the people you work with, and the three of you have given me a lot of hope and energized myself. But I just wanted to open this up for you to talk about.
I've been waiting for this question.
Sally, please.
I have been waiting. This is my question.
Okay.
Because when Dobbs came down, I had so many people reaching out to me that were shocked, right? They were absolutely shocked. They couldn't believe that it happened. And I'm sitting here going, where have you been? But then I took a step back, and it's awful what's going on right now. But when you look at abortion, and it may have been legal, but it was not accessible, and certain people could get it and certain people could not. Some in different states, people had to drive. There was one clinic, they had to drive so long, there's waiting periods. Like, it was even in Connecticut, where we're supposedly abortion friendly, there are barriers to care. And so one of the things that I'm really hopeful about when it comes to is that people realize how bad it is, how the fact that it was not actually accessible to large portions of the population, and that when we get abortion back, that we do it right this time, because we didn't do it right before. It left so many people without that option, and I really hope that we actually get it right, and that it is abortion for anybody who needs it, whenever they need it. And so I know maybe this is a little bit like, silly, but this is like, it was not good before. And we just kept kind of losing right after right after right. And we never were gaining anything. And I'm really hoping, because this is so bad. I mean, it's treating, people who can get pregnant as second-class citizens. It is saying that you don't own your body. You have no rights to your body if you happen to become pregnant. That is completely unacceptable. So I'm hoping enough people now go, wait, this is just wrong. And that maybe this time we can get it right. I was really excited.
Thank you, Sally.
Well, that is such a great jumping off point for me, Sally. So there are a few things that give me hope. And I saw a question about like, what can we do after the elections? And I can take a crack at some of that as well. So what gives me hope? What gives me hope is that it is absolutely clear. It's in poll after poll after poll after poll that the American people support abortion access, that this is not a controversial issue. This is a mainstream issue, and we should not allow people to make it a controversial issue, because it's not. Even in Rhode Island, the most Catholic state in the country, there is overwhelming public support for access to abortion care, and including Medicaid coverage for abortion. So don't be afraid. I am hopeful, because I know that we are on the side of the humongous majority of people. I'm hopeful because people are starting to tell their stories. And so when you ask, what else can we do? What can we do? If you have an abortion story, tell it to somebody. Think about what Sally just said. She shared her story, and all of a sudden her friends were sharing their stories with her. We have another abortion storyteller who's an elected official in Connecticut. She shared her story, and before she did, she told her 3 best college friends, and it turned out they'd all had abortions. So abortion storytelling is absolutely critical to shifting the narrative and taking away the shame and stigma associated with abortion. So I hope that if you have an abortion story to tell, you will consider telling that story. And then, the last thing I think I'll say is that a post-Roe world does not and should not look like a pre-Roe world, or even a between Roe and post-Roe world. Let's dream of something better. Let's dream of something bigger. Let's dream of a world where we're truly, to borrow a very popular word, and to paraphrase my colleague Alexis McGill-Johnson at the national office, let's dream of a world with actual liberation, and create that world. Let's work for that. Let's not work for the basement. Let's work for the ceiling. And I am hopeful that I think we can create that. I can include in chat, or we can send out later, some other action steps people can take.
Thank you.
Anybody that has ever received an email from me knows that the quote at the bottom of it is Dr. Martin Luther King quote about the moral arc of the universe. The moral arc of the universe is long, but it bends towards justice. And, I tend to think that the moral arc of the universe is long, and we bend it towards justice. And what keeps me hopeful is that, the work everything that I'm working are some of the hardest, most deeply entrenched issues in our community: housing and housing policy, education policy, healthcare access. And if I didn't look up and celebrate the victories and see the possibilities, it would be totally depressing. And so it is the ability to continue to see, to hold the faith and the hope, and to celebrate the wins, and to see the progress. And for me, part of the progress is that this group of folks is on this screen freely talking about abortion and personal abortion stories in a way that dispels the stigma and the taboo nature of it, and that should bring us hope, because it's a demonstrated point of movement from where we have been in this past, where we've been. It brings me hope that we've got folks mobilized to get behind folks and elect the right people. It keeps me hopeful that there are great people like this working in this, and it gives me hopeful that we're doing it from a frame that's really equity-based, and really recognize that if we are not fighting for this right to be accessible to the most marginalized, then we're not fighting for the right. And I think those are all shifts in the reproductive justice movement to really be in that place, and that gives me hope.
Thank you all. I wanted to move to a couple of questions from the audience. One really great question is, they're disappointed by the list of politicians in support of reproductive rights. And most of those politicians have been long-standing career politicians in power, and they feel like this has happened on their watch. So how do we bring fresh new voices and leaders to the table? And I just want to say for myself, in talking with millennials, Gen Z, and forward, even my daughter's age, she's only 9, there is great hope and consciousness in their future. I find, but how to get them to the table and how these voices can be empowered and come to the front lines, I would love your opinions. So
I don't have an answer, but that was a great question. Like that was I don't know whoever asked that question, great question. So now
storytelling is part of it, right? The other side gets to dominate the narrative if the stories aren't told that back up what Amanda just said about the majority of people in this country are actually for abortion access. And so we have to make sure that those stories are loud enough that the folks that feel like this is, something that they can't be public on actually recognize that there are people behind them. So the story is part of it. And then, right, we have to get involved. So many people in my own network get so turned off and say, oh, politics, I don't want to have anything to do with that. Politics is in every single aspect of our lives. And so if you're feeling fired up about this or about any issue that touches you personally, like find a way to get in, like, because again, you're looking for the next candidate. The next candidate might be you. Might be your friend who's getting fired up with you. And one thing that we know about women candidates is that male candidates rarely have to be asked; they jump right in. Women candidates get in races because other people invite them in, and so think about that as you're activated about this stuff. Think about how to get involved in your local town committee, in your local, because that's where the next generation of leaders are going to come to. And the last thing I'll say is we all have to know how to pass the baton. I hear so many people talk about next generation young leaders and then grip that power so tightly and they can't pass it. Like we have to know also when it and be grooming and thinking about that so that we are really modeling how to pass that on to the next generation. Because I agree, I got great hope, and I have sons. They are amazing, and the things that they talk about, the awareness they have, the wokeness that they have, it's amazing, and it gives me great faith that the next generation is going to bring us forward.
I did want to say I did actually have something to add to this, but so I was going to be filmed for a commercial for Dick Blumenthal. And when I got there and they asked me what I wanted to talk about, I said abortion. And I was like, I want to use the word abortion. If I can't use the word abortion, then I'm not going to do it. And the woman who was filming, she's like, I want you to use the word abortion. I want you to say it. Yes. And I have no idea if it made the cut. I have no idea about the commercial. But for me, it was making sure that politicians who've been there for a long time are doing the things they need to do. And if you can't even say the word abortion, like really you shouldn't be there anymore. So it's also questioning who is in power and who has been in power for decades.
The one other thing that's coming to my mind is I so appreciate the question asker and that they said they sort of feel like it happened on their watch. And I guess I want to invite us all to remember that it happened on all of our watch. It happened on the watch of a collective majority of people. And in part, again, it is because, Sally, I think you were the one who said this, that, when we had like the table scraps of Roe, we weren't, hoping for the bigger dream dinner of like real reproductive freedom. I think there are so many ways to enter into social change. And what I would hope is that everybody enters it into whatever way sort of fits them. For some people, it's, protesting and marching. For some people, it's donating, giving. For some people, it's running for office to make change themselves. For some people, it's writing and storytelling. For some people, it's volunteering at Planned Parenthood on our welcome crew. For some people, it's going to school to become an advanced practice nurse, or a physician assistant, or a physician, or whatever, to become a healthcare provider and provide reproductive healthcare to people who need it. Like, whatever is your way of stepping into affecting social change is a valid way. What we need is people stepping into whatever is their way.
There was a question, Amanda, you mentioned Roe as the floor. What do people need to know about future efforts to codify Roe? So there has been a decades-long on the other side to take away our rights. What is our long-term plan? How can we do this in addition to some of the things that you've mentioned before we close?
Yeah, I mean, I think we've talked about some of the things that people can do. I do think we need to dream of a much more aspirational world. There is a real risk, depending on what happens federally, that there will be a federal abortion ban. So let's not let that happen. Let's do everything we can to prevent that from happening. And it would be, one possibility. And Senator Blumenthal has been a huge champion for this, and Senator Murphy is a supporter, Congresswoman Hayes, all of our elected officials in Connecticut are supporters of the Women's Health Protection Act, which would codify the tenets of Roe into federal law. I mean, that would be incredible, but it still wouldn't be enough, because we absolutely need to be dismantling all of the intersectional issues that impact people's meaningful access to healthcare. Hey, we love volunteers. You want to volunteer with Planned Parenthood? That is a great way to get involved. We love our volunteers. So that's another way to get involved. I do want to highlight, that there are other organizations that are an important part of this movement and just don't happen to be in this conversation today. There are independent abortion providers. There are independent abortion funds that provide resources to people seeking abortion care who do need that kind of support. Organizations like NAF, which is sort of it's a national network of abortion funds. They are a place that people can donate to, and the resources will go where they're needed the most to provide meaningful direct support to people seeking abortion care. And it may feel unsatisfying sometimes to donate money, but donating money is incredibly important. There are people who do this work every single day who have made it their life's work, and they need support. And support comes in the form of financial resources that make it possible for us to do this work. That's what makes it possible for us to promise that we won't turn patients away based on their ability to pay. It's not because there's money tree in the backyard. It's because of donors and supporters like the people who make up the Community Foundation of Greater New Haven. That is a meaningful way to take action. You can follow us on social media, or follow other abortion providers or reproductive rights organizations on social media, and then click like and share what we put out there. Follow us on Facebook, follow us on Instagram, follow us on TikTok. You can follow us at PPSNE. I'm also the president and CEO of our C4 organization at PP Votes Connecticut. You can follow us at PP Votes CT. You can follow us on Twitter. I'm a little cranky at them these days, but you can follow us there too. But what matters most is not just reading it, but engaging, clicking, liking, and sharing, and amplifying the message. And you will find that the people in your network are going to click, like, and share too, because they're going to be like, I see myself in what you are sharing.
Thank you. And on that note, I wanted to thank the panelists so much for sharing your individual stories, for sharing the work, for sharing all the battles that you are fighting on all of our behalf. Thank you so much. I also want to thank the audience for coming, and this will be, there will be a recording of this, and please fill out a quick evaluation that will pop up once you log off the seminar, and a follow-up email with a link to the recording will be shared within the week. Again, please vote, please amplify, please support, and thank you so much. Thanks again to the panelists and to Sharon Capetta and the Fund for Women and Girls for having this such important issue highlighted at this point.
Can I make one last plug, Christine? Because another important way for people to sort of put their action where their mouth is to get care at Planned Parenthood.
Yes.
Like, we are a comprehensive healthcare provider. Come get your care with us. We are a great, high quality place to get your healthcare. Anybody can come to Planned Parenthood.
Great. Thank you.